This chapter is going to cover personality disorders, borderline personality disorder, antisocial borderline or antisocial disorder, and other types of three groups of different types of personality disorders. So some of them are quite interesting, and some of them that you may be able to relate to things that you've seen on TV or things that you've read or heard in the news. When it comes to the personality, this is what determines how people cope with their feelings and impulses, how they see themselves and others, how they respond to their surroundings, and how they find meaning in relationships and different cultural values. Also, everyone has a temperament. And a person's temperament usually becomes more stable over time. It's usually influenced, as I said, by genetic variables. It's present from the get-go. You may see someone who's always been a very calm, low-key, easygoing, whereas others can fly off the handle. Our character are those aspects of personality that are the product of learning and interaction with the environment. And of course is really influenced by our environmental variables, the kind of area that you grow up in, what you're exposed to. With personality disorders, these individuals are very rigid. They are not experienced as uncomfortable by as the individual, but we're uncomfortable. They often occur to have depression, anxieties. Their pattern of, taking in information, how they perceive things and think about different things can also impair their function out in civilization and socially, and also in the workplace. This is one of those axis 2 diagnoses. If you remember from way back when we talked about the axis, this is an axis 2. And lots of times it's difficult to treat because they don't see themselves as having a disorder. With personality disorders, they have the ability to merge personal boundaries with others. Their boundaries act as filters, permitting what is acceptable in life and what is not. It's been shown that those who have very weak boundaries themselves tend to violate the boundaries of other individuals, and they don't feel like they're doing anything that is uncomfortable to others. Some common characteristics that there is no single cause that causes personality disorders. They likely can come around from interaction between some type of biological factor and the environment. These characteristics are that they lack insight about what they're doing. They don't have a deeper thought. They just act out. And they don't really think there should be consequences for their behaviors because they don't see their behavior as being wrong. Some of the risk factors that we'll see is that individuals with these personality disorders tend to be less educated and unemployed. Usually aren't married or in a relationship. They may even be substance abuse users, may commit violent crimes or even nonviolent crimes, and even sex offenses is not unusual. As far as the environmental influences, there could be a history of some type of abuse as a child. They have influences biologically through genetics, or maybe have some psychological issues that have happened, even some types of exposures that may lead to these types of personality disorders. When we talk about those defense mechanisms, many that you will see with those with personality disorders can be those listed here. Repression, suppression, regressing, undoing, and splitting. Splitting is when they have the ability to incorporate positive and negative aspect of themselves or others into a whole image. I'll give you an example of that in class where I have one that I want to present. Commonly, we see this with borderline personality disorder, where the patient tends to characterize people or things as all good, or they're all bad. They don't know how to split the two. They don't know that people can be good, a little bit good, and we have a little bit of bad. They're saying you're either this way or that way, and that's that splitting. They just don't know how to divide that. So they're either saying everybody's good or they're not. So an example might be that your patient might say, you are the worst person in the world. And later in the day, they might say, you are the best person in the world. But the nurse from the last shift, she's absolutely terrible. And so they start saying, you're good, they're bad, you're good, they're bad. So everybody's good or bad. And then they try to get people to work against each other. And it's kind of a game, but they don't see anything wrong with what they're doing. This slide just really shows you some of the biological factors. I'm not going to go into that, but you will see where they have the lower 5-HT and this antisocial and borderline disorders, and they also have diminished blood flow through certain areas of the brain, some EEG changes, and the others that they have decreased levels of dopamine. Which is quite interesting when you think about some of the neurotransmitters and things that are, the factors that can actually lead up to it biologically, and you look at that and you think, okay, it does make sense. And then we have the psychosocial factors, such as parent-child interaction. What was their environment? How were they raised? Was it nature versus nurturing? Were they very nurturing parents, or were they kind of abusive or left alone or unfeeling? Maybe the parents had some type of disorder with personality, and now the child acts out the same too. And another one, I think, is abandonment. And sometimes these personalities come out as way of defense mechanisms. There's also some other theories out there, such as social theory, and this is social oppression and meeting social expectations. Family theory is maybe they came from a dysfunctional family, maybe as part of the diastasis stress model that we talked about earlier when we talked about stress. Biology or social interactions may also be the culprit, inconsistent parenting and abuse. The last one, gender bias theory, is the rigid role expectations. Men don't cry. Men are independent, self-sufficient. They should be very active, and they're the thinkers. They should be the smartest ones. Where women are to be more submissive and dependent and passive and more feeling. The humanistic theory looks at resiliency, the overuse of projection, and so they pass on their own hostilities onto others, or maybe they feel like they failed to meet certain developmental levels, or there's a delay, and we may see this with the borderline personality disorders because we may see them, individuals act more like a toddler than they would an adult. And that's from that developmental failure or delay that they may have. Earlier I said that there were going to be three groupings or clusters. Cluster A, B, and C. Cluster A are your odd-eccentric individuals. These are the ones who are paranoid, schizoid, or schizotypal type of patients. The reason they're characterized this way is they're characterized because of odd beliefs that they have. And with your schizotypal, their speech might have some type of loose association, tangential. It's a loose association, interpersonal difficulties. They're very eccentric in their appearance. They may have magical thinking or perceptual distortions, and these are not clear delusions or hallucinations. Their affect may be inappropriate, anxiety in a lot of social situations, they're not comfortable, and they they're avoided by others, so they're very isolated. For the paranoid, they're characterized by distrust and suspiciousness towards others. This is based usually just on some kind of unfounded belief that, that they think other people want to harm them, exploit them, or deceive them. With the schizoid, that's characterized by an emotional detachment. Their affect is very flat or blunt. They have disinterest in close relationships and indifference to praise or any type of criticism. They're often uncooperative. They prefer to be alone, so they like solitary activities and occupations. The next cluster is your dramatic emotional. This is going to be your borderline personality, your histrionic, your narcissistic personalities, and your antisocials. The antisocial actually has any disregard for other people whatsoever. They have a lot of, they're characterized by exploitations. They may repeatedly break the law, be deceitful. They fail to accept personal responsibilities. We usually see this around or before the age of 15 by these individuals having conduct disorders. You also have your egocentric. These individuals have, as you can imagine, poor relationships, and they exploit others, and everything's about them to show that they're the best, and so they actually put others down to make themselves look good. With your borderline, they're very unstable, so they have their affect, identity, and their relationships are all unstable. They're usually self-destructive, as you can see here in this video where this individual was cutting themselves. They have this fear of abandonment. They do that splitting behavior, splitting others against each other. Very manipulative and very impulsive. They may even be suicidal. They also try, again, the self-mutilation, and they are usually a high risk for suicide. They often try self-mutilation, as I said, and sometimes it's for attention or just to see the reaction that they can get. Your histrionic personality, they're emotionally, they're attention-seeking behaviors. They need to always be the center of attention. They have a high need for approval from everyone, and they're consistently seeking assurance, saying, they come in and they have this beautiful outfit on, they got their hair done, and they're like, oh, I just look awful today. And they want everyone to say, oh, you look so good, and I know we've seen that younger in school, but these people live by that. They want everyone to give them their praise. One of the ones I think is very interesting, and I think because I know someone who has this disorder and they keep going in and out of treatment, is the narcissistic disorders. These individuals are very arrogant and egotistical. They have a very grandiose view of themselves and their self-importance. They have this need for constant admiration. They actually lack empathy for others. They're often very sensitive to criticism. They don't like to be criticized whatsoever. They may even go into a rage, and they expect special treatment. Charles Manson, I can't think of the girl's name, the one who was at the trial, and she ended up marrying the boy who was the Mormon. They were going to get married. They were having relations, and then she stabbed him several times, and then she tried to turn things around that it was all him and he was attacking her and so forth. And I can't think of her name. I'll probably think of it before we have class. You also often see many movie stars, actors, actresses, and politicians who also have this disorder, and that they're very, what we say, a narcissistic personality. The other cluster is cluster C, and this is anxious and fearful. These individuals are very avoidant. You have the dependent, and you have the obsessive compulsive. With the avoidant, social inhibition, they have avoidance of all situations that require any type of interpersonal contact. They want close relationships, but they're not comfortable with it. They feel very insecure and inadequate. They're very shy, very fearful. They have this massive fear of rejection. They often are very anxious in a social situation. They're very uncomfortable with it, and they're very overly sensitive to criticism. With dependent personality, this is extreme dependencies in close relationships. They're actually over dependent on that person. They have this fear of rejection, being alone, or being abandoned. They have a severe lack of self-confidence in themselves. They most frequently are seen in personality disorders in the clinical setting because they can't let go. These are the people who may even follow the person around to make sure they don't leave them. They have to have them in this relationship with them. So we do see this a lot in, or the most, in the clinical setting out of all the personality disorders. The last one of the clusters is obsessive compulsive personality disorder. It's different from OCD. These individuals need to be in control. As you see here, they're characterized by being a perfectionist, and they're very inflexible. They're also procrastinators and cannot make decisions. They focus on orderliness, and everything is in control. They have to have everything just right and just so. They may not be able to accomplish given tasks because of their overly compulsive personality, and they're unable to really even express emotions. Here's for other disorders, we have the depressive personality disorder, and these are the people who are like Eeyore. They're negative, pessimistic, gloomy, unhappy. They can never anything positive to say. They're depressing to be around because they're just everything's, the glasses always half empty. Nothing's going to come out right. They're no good. They can't do anything. This project's not going to work. You're not going to get through this class. I'm not going to get out. Even if I do get out, I'm not going to get a job. Those types of individuals. Another interesting, beside, I have some of my favorites. Another interesting disorder is the passive aggressive. So they passively resist, as it says here, fulfilling a routine social and occupational task. So they may procrastinate, be forgetful, intentional inefficiency. So they act like they're doing something, but they kind of set somebody else up. They complain of being misunderstood and unappreciated by others. They complain about no one understands them. They're unappreciated. They're very sullen, argumentative. Unreasonably, they criticize unreasonably. They scorn authority figures. They express hostility and resentfulness. They alternate between being hostile and defiant and contrite. One of the things that we want to think about when we're thinking about the nursing process is safety. We need to keep them safe, especially those at risk of harming themselves or others. Being consistent. Consistency, even with setting limits, needs to be the same, rewards, and so forth. We need to make sure that we set boundaries. and make sure there is appropriate self-disclosure. In other words, not going beyond and not being manipulated by the others to go beyond those boundaries. On the assessment, we're going to look over these points here: their behavior, their affect, their cognitive abilities, their social abilities, any influences that come from a certain culture, and any age-specific characteristics, and even developmental delays or developmental milestones that they haven't reached. So looking at cluster A for behavior, as you see here, I have it all listed out here for you. They're loners, they're solitary activities, they're very eccentric, argumentative, and they have an odd speech. Their affect, and so forth. So I'm not going to read out through these, but I do want you to see these bullets. I think they're very interesting. Okay, and then here's your assessment for your cluster B personalities. And then your cluster C personalities. When it comes to communication, those in cluster A, you want to approach them in a very gentle and non-intrusive manner and show interest. With cluster B, it's definitely important that you use consistency and you limit the setting. You want to make sure you maintain a good, clear communication among the staff as well, especially when it comes to splitting. And then cluster C, you want to point out any kind of behaviors that are very avoidant and any secondary gains that they may be trying to point out, any secondary gains that they're trying to receive. Interventions for the paranoid personality disorder: make sure that you respect their personal space, respecting their preferences. It's good to give feedback based on nonverbal cues, and you want to provide them with a daily schedule of activities and inform them of any changes ahead of time. We also want to help them to identify ways to adapt diversionary activities. So you can use role play, make sure that when you communicate with them that it is in an objective, matter-of-fact approach. Use concrete, specific words rather than global abstracts. Be very, very specific in your speech. When you have an angry client, we need to have ways to work with them. So you always want to make sure that you're calm and use a very unhurried approach. Do not touch them indiscriminately. That can actually end up hurting you and really set them off. Respect their personal space. Use active listening skills, and always remain aware of your own personal feelings. Interventions for the antisocial personality disorder: you want to, again, set them, approach them more in a matter-of-fact way, again, and you want to show that you are concerned. Make sure that you are consistent. You communicate in a set manner, and you maintain consistent rules and regulations. Do not argue, bargain, or rationalize with them. You want to confront inappropriate behaviors, and you do not seek approval or coax them. Use choices and consequences with them. Be alert for flattery or verbal attacks. Interventions for the manipulative behaviors: they should be assigned one primary staff member. You want to maintain realistic limits with enforceable consequences. Give a rationale for their limits and consequences. You want to model respect, honesty, openness, and assertiveness. And you want to confront the client each time manipulation does occur. Interventions for the dependent personality disorder: you want to evaluate your patient's ability for self-care. You want to avoid doing things that the patient's already capable of doing. Help them identify their assets and their liabilities. Emphasize their strengths and their potential. You want to encourage them to take responsibility of their own opinions. And lastly, you want to point out when the client negates their own feelings or opinions and to please someone else. Our last slide talks about illness management. So we want to teach them about their diagnosis and the etiology, and explore how past events can influence the way patients think about themselves and others. We want to also connect their patterns of thinking to their moods and emotions. We also want to provide information on treatment processes. And lastly, explain that changes do occur slowly and the process will take time. It's not something that happens overnight or within a week.